Very good morning, students. This is a Viva demonstration on the urinary bladder. I will tell you which are the important questions which an examiner can ask on the urinary bladder if the urinary bladder as a specimen is given to you in the Viva examination. Now, the first question which may be there when he is asking you to take the urinary bladder in your hand, he may ask you that what is the location of the urinary bladder in the pelvic cavity. You can say that urinary bladder is present in the lesser pelvis, okay, below the pelvic brim, I mean to say, into the behind the pubic symphysis, okay, and it is present in front of the rectum in case of the male, and in case of the female the urinary bladder is present in front of the cervix and that of the uterus. Okay, so this is the location of the urinary bladder which you should reply. The next question he may ask is, what is the shape of the urinary bladder? I have just cleaned this urinary bladder and then you see the shape. Now, what you are seeing here, the urinary bladder, this is a triangular surface which is the superior surface of the urinary bladder. This is the apex of the urinary bladder is here. Base is on this side, okay, which I will tell you later. Now, from the apex there comes out an obliterated ligament, and this obliterated ligament is the obliterated urachus, okay. Now, then you can say that this has the various surfaces, the base and the neck is here, which is in continuity with that of the prostate. This portion of the structure is the prostate, above is the urinary bladder, and then you can say that its shape is the tetrahedral in shape, okay, and when it is full it becomes oval in shape, okay. So when it is empty, the shape of the urinary bladder is the tetrahedral shape. Now then, just show him the different structures which are coming out or going inside the uterus. So he may ask you, what is this structure which is attached to that of the urinary bladder? You can say that these are the right and the left ureter which are opening into the urinary bladder. That means they are penetrating the urinary bladder here. Okay, then you can show that this is the base part of the or posterior surface of the urinary bladder, and just infromedial to this ureteric or opening into the urinary bladder, this is the right and this is the left vas deferens. You can see this long tube. These are the vas deferens which are coming on to the posterior aspect or to the base of the urinary bladder. There is a swelling seen in the right vas deferens here, maybe a cyst or some other abnormality may be there. So this is the right vas deferens, this is the left vas deferens, and lateral and inferior to this vas deferens, these are the two seminal vesicle, which is a glandular structure, a coil tube, okay, which is about 6 inches long, but because of coiling it is around 2 inches long. So this is the seminal vesicle. The duct of the seminal vesicle or the lower end will unite with that of the vas deferens here to form the ejaculatory duct, which will penetrate the superior surface of the prostate. This is the prostate gland. So this is the vas deferens of the left side, seminal vesicle of left side, and they join with each other to form the ejaculatory duct. So from right and left side, these two structures are seen. So on the basal aspect of the urinary bladder or on posterior surface of the urinary bladder, you can see many structures. Right and left seminal vesicle, the vas deferens, okay, and the opening of the ureter here, and the median ligament, okay, which is seen here. Then there another question may be there, what is its capacity? You can always say that in a adult person the capacity varies depending on the person's, I mean to say, the personality means the I mean to say physical form. It may vary from 120 to 320 milliliter, but on an average it is about 220 milliliter capacity, after which a person will feel the desire to micturate or to pass the urine. Now, then he may ask you, show me the borders and surfaces of the urinary bladder. You can say that this is the apex, okay? There is an apex from which this ligament is coming out, and then there is a base. Just opposite to the apex, this structure where seminal vesicle and vas deferens are present, this structure is the base of the urinary bladder on which they are applied. Then it has a neck. See here, this part which is continuous below with that of the prostate here, this is the neck of the urinary bladder. Okay, so this part is the neck of the urinary bladder. It has a superior surface, this surface, it is the superior surfaces, and then there are two infralateral surface, this one, right and left infralateral surface, where I am just putting my fingers. So this is the right infralateral surface and this is the left infralateral, and this triangular is the superior surface is there. Now it has the various border. There is this anterior border between two infralateral surface is the anterior border. Then there is a posterior border where there are the openings of the two ureters are here. So this is that posterior border where two ureters they are opening. This is the posterior border is there. Then there are two lateral borders. Okay, there are two. These two are the lateral border extending from the apex towards the opening of the ureter. These are the two lateral borders. Okay. Now, which ligament is attached onto the apex? That may be a next question. And I have already said about to you that there is a median umbilical ligament, and it is the fibrous remnant of the intra-abdominal part of the allantois. So this is the fibrous remnant of the intra-abdominal part of the allantois that is attached to the apex of the urinary bladder. Now, then next question, which is an important question, is that what are the relation of the base? And I have just also told you when I was just orienting this specimen to you, I told you the base has a supralateral angle. At its supralateral angles, these two angles, at the supralateral angle there is the opening of the ureter on the base. Okay, so this is the supralateral, beyond which it is the base or that of the posterior surface, and at this supralateral angle the right and the left ureter they are entering into the musculature of the urinary bladder. Okay, now, at the inferior angle, okay, of this, there is, if you see this inferior angle tracing the from apex towards the this inferior angle anterior border, there is a opening, okay, this is the opening of the urethra. See here, this urethra is coming out from the prostatic part, okay, and then at the junction of the bladder and that of the neck of the, I mean to say, the prostate, there will be the opening of the urethra, okay, the neck of the bladder. This is the neck of the bladder, and the same, I mean to say, urethra, that is the prostatic urethra, will come out from the lower end of the prostatic gland. So this is the, then he may ask you what are the relation of the posterior surface in male. Okay, in male you can say that the posterior surface or the base of the urinary bladder, it is related to that of the recto vesicle pouch. That means the peritoneum covering the superior surface of urinary bladder for some distance between the opening of the two ureter and below it will go on to the base or posterior surface, and then from here it will reflect onto the rectum, and that will form a pouch what is called as the recto-vesicle pouch, which is quite a shallow pouch, not as deep as that of the recto-uterine pouch in that of the female. And then you can see that on the posterior aspect in the lower down after the pouch there will be the presence of, which I have already shown you, the right and left seminal vesicle. They are related to the posterior surface or the base, and then these are the vas deferens. They are also related to that of the base. Now an area between the right and the left vas deferens, this area, it will be in relation to a fascia which will separate it from that of the rectum, and this is called as Donon-Wheeler's fascia. Donon-Wheeler's fascia. So this Donon-Wheeler's fascia is between the posterior surface or the base of the rectum between the two vas deferens uh, uh, and the rectum and that of the rectum. So this will be the relation in the lower part. But if it is a bladder of the female, then you can say that the base or the posterior surface of the bladder is neither related to seminal vesicle nor to the vas deferens, because they are absent in female. And here this posterior surface of the base of the bladder will be in relation to that of the cervix, okay, forming what is called as the utero-vesicle pouch, okay. Then it will form the utero-vesicle. That is the difference between male and the female pelvis, okay, male and female pelvis. Okay, this I think completes the external features of the urinary bladder, and in the next video I will come and will give you the interior, will describe the interior of the urinary bladder, and will take a section from the neck of the urinary bladder which is at the junction with that of the prostate, and will show you the interior of the prostate as well as that of the urinary bladder. Thank you very much for watching this. I mean to say the Viva on the urinary bladder.